Today class is about anatomy of pharynx. Pharynx is nothing but a musculofacial tube that extends from base of skull to the lower border of cricoid cartilage as it connects nose with larynx and oral cavity with esophagus, as it is an inverted cone structure as below drawn in this diagram. As we can see, the space behind the nasal cavity is known as nasopharynx. Behind mouth is known as oropharynx. Behind larynx is known as hypopharynx. As in this diagram, we can see the extension of the pharynx. It extends from base of skull till the cricoid cartilage. As anteriorly, we can see the soft palate, hyoid bone, as well as cricoid cartilage, as well as thyroid cartilage, and posteriorly C1 to C6 vertebrae it is related. As now we'll read about the nasopharynx boundaries. Nasopharynx extends from base of skull till C1 vertebrae, as or we can tell related to hard palate also, as it is just behind the nose, so it is known as nasopharynx. Next, the oropharynx, it extends from palate and till the hyoid bone. It is between its vertebrae relations are C2 and C3. As it's just behind the oral cavity, it is known as oropharynx, and the extension of hypopharynx or laryngopharynx is from hyoid bone till the cricoid cartilage. In this, it is related to C4, C5 and C6 vertebrae. As now we can see the schematic diagram of the pharynx. Now we will start to learn about the pharyngeal wall. As pharyngeal wall is an musculofacial tube, as it has a mucous membrane which is lined by stratified squamous epithelium except nasopharynx, which is lined by pseudostratified ciliated columnar epithelium. As next layer is, first is mucous membrane, next is subepithelium layer, which is also known as subepithelioid lymphoid layer. As in this, the lymphoid tissue is arranged in form of an ring structure, so it is known as Wardier ring. The Wardier ring consists of adenoid, also known as Lusca's tonsil, which belongs to nasopharynx. Next structure is tubal tonsil, which also known as Gerlach's tonsil, palatine tonsils, and lingual tonsil. This all will form like a ring, which named as Wardier's ring. As we can see nodules on the posterior pharyngeal wall, they are also the lymphoid tissues. Now, the next layer, third layer, is pharyngobasilar fascia. It is anterior fascia of pharyngeal wall. As it is tightly adherent to the pharynx. As it extends over tonsil to form hemicapsule. Next layer is, fourth layer is muscle. In the pharynx we have two type of muscles. that is longitudinal muscles and circular muscles. In longitudinal muscles, we include three types. Stylopharynx, which arises from the styloid process and get attached over the oblique line. Next, the salpingopharynx means it is arises from the eustachian tube as well as it get attached over the posterior border of the hyaloid cartilage. The last muscle is palatopharynx as it arises from the soft palate and get attached over the posterior border of the thyroid cartilage. As all of these are supplied by the 10th nerve except stylopharynx, which is supplied by the 9th nerve, that is glossopharyngeal nerve. As in this we will mark the muscles. This is stylopharynx, salpingopharynx, this is palatopharynx. Next, we finished longitudinal muscles. Now the circular muscles. Circular muscles include three: superior constrictors, middle constrictor, inferior constrictor. As in this diagram, I will explain about its origin as well as insertion. As first, it is superior constrictor, which arises from the 4 points from pterygoid hamulus, pterygoid raphe, and mylohyoid line, as well as dorsum surface of tongue, as it arises from this 4 structure and get attached over the pharyngeal raphe, as all three muscles have common attachment over the pharyngeal raphe. Their insertion is same but origins are different. As now middle constrictor, MC means it is a short form for middle constrictor. As we can see, it arises from the styloid ligament hyoid. In this, it arises from as well as greater cornea, up lower border of lesser cornea, and upper border of greater cornea. It has same insertion over the pharyngeal raphe. Next, it is inferior constrictor. We have two parts, the thyropharynx and cricopharynx. The part which arises from the thyroid cartilage is known as thyropharynx, which arises from oblique line of the thyroid cartilage. As next, cricoid pharynx means it arises from the cricoid cartilage, so it is named as cricoid cartilage. All of these are supplied by vagus nerve. As there is one important point about Killian distance, as all the superior constrictor, inferior constrictor are arranged like a cup in a cup manner, but in the inferior constrictor between two parts there is a weak point due to different nerve supply. The above thyropharynx is supplied by interlaryngeal nerve, below is supplied by recurrent laryngeal nerve. So due to different this, if there is any incoordination between nerve, which leads to creation of space, which will leads to Zenker's diverticulum. As the now we'll see what are the structures between the constrictor muscles, as there is a space present between base of the skull and superior constrictor, as it is marked in the yellow in the diagram. The space is known as sinus of Morgagni. As in this we can see 4 structures: the eustachian tube, levator vellae palatini, palatine branch of pharyngeal artery, ascending pharyngeal artery, as these are the most structures that are present in the sinus of Morgagni. As in between superior constrictor and middle constrictor, we can see two structure. One is stylopharynx and another is ninth nerve, that is glossopharyngeal nerve. As in between in middle and inferior, we have one nerve, that is internal laryngeal nerve, and artery is superior laryngeal artery. And in between esophagus and inferior constrictor, the one nerve and one artery is present, that is it is also space. In this also we have two structures. One is recurrent laryngeal nerve and inferior laryngeal artery. As once again I will tell what are the structures between the constrictor muscles. As in sinus of Morgani, we have four structures: eustachian tube, levator vella palatini, palatine branch of pharyngeal artery, ascending pharyngeal artery. And in between superior and middle constrictor, we have styloid pharynx muscle and glossopharyngeal nerve. In between middle and inferior, the structures are inferior laryngeal nerve, superior laryngeal artery. As in structure between esophagus as well as inferior constrictor muscle, there is a nerve, recurrent laryngeal nerve and inferior laryngeal artery. As in this diagram, there is a muscles, circular muscles we can see. As the blue structure that is marked is superior constrictor. The orange is middle constrictor. As we can see the attachment, one is pterygoid hamulus, another is pterygoid raphe. Next, posterior to mylohyoid line and dosum of tongue. It gets inserted over pharyngeal raphe. The middle constrictor. The middle constrictor arises from the stylohyoid ligament, lesser cornua, greater cornua, and it gets attached over pharyngeal raphe. Inferior constrictor has two parts, thyropharynx as well as cricopharynx. Thyropharynx arises from the oblique line of thyroid cartilage. Cricopharynx arises from cricoid cartilage. They both get attached over pharyngeal raphe. As there is a weak connection in between thyro and cricoid pharynx due to different nerve supply. If there is a nerve incoordinates which causes a outpoaching over it, which leads to Zenkus diverticulum. Now, last layer, that is buccopharyngeal layer, which is just a thin posterior pharyngeal layer. Now, that spaces of pharynx is also important. Now, let us learn about the spaces of pharynx present between the layer of pharynx. As the spaces are, there are three spaces mainly present over the layers of pharyngeal wall. First, retropharyngeal layer, that is present between buccofacial and alar layers. Next, dangerous area, retropharyngeal space, dangerous area. Dangerous area is present between alar as well as prevertebral. Next, prevertebral space, that is present between prevertebral fascia as well as vertebrae. As in between alar and prevertebral fascia, it is called danger fascia because it goes till diaphragm. So the infection can spread to mediastinum. We can see that in mediastinum we have structures of great vessels like inferior vena cava, aorta, heart, which get spread to that infection, which leads to further complications. So it is known as dangerous area of, as we can see the spaces and its boundary. As in retropharyngeal, upper boundary is superior is base of skull, lower is till T4 vertebrae. Anteriorly buccopharyngeal fascia, posteriorly alar Now dangerous area. Upper base of skull, but it extends till diaphragm. Anteriorly it is by LR, posteriorly by prevertebral fascia. Prevertebral space. It also from base of skull till T4, but anteriorly by prevertebral fascia, but posteriorly by vertebral fascia. The next space we going to learn is parapharyngeal or pharyngomaxillar or lateral pharyngeal space, as it is an inverted pyramid shape. As we first see the boundaries of this, and I will going to explain about it in a diagram. The upper boundary is base of skull, lower is still hyoid bone, medially by lateral pharyngeal wall, that is buccopharyngeal fascia, and laterally by mandible and its structure, means medial pterygoid, masseter and parotid. Now in this diagram let us learn how it is. As it is an inverted pyramid shape, as it has two components. Posterior it is, as it divided by into two components by the styloid, as it is anterior part, it is posterior part. As anterior part has mainly fat branches of maxillary artery, and we have sensory branch of mandible. It includes auriculotemporal nerve, inferior auricular nerve, inferior alveolar nerve, lingual nerve. As in anterior or p-styloid compartment, we have mainly three contents, mainly fat. We have branch of maxillary artery, sensory branch of mandibular. It includes auriculotemporal nerve, inferior alveolar nerve, lingual nerve. As in posterior or post-styloid, we can see mainly the nerves are there, as well as intracarotid artery and intrajugular vein, as well as cervical sympathetic chain is also present. As the lateral pharyngeal is mainly divided into anterior compartment, which is known as pre-styloid, and posterior compartment known as post-styloid. It is divided by based on styloid, so it also named on it. As now the spaces, earlier we learned about retropharyngeal space, which is between buccopharyngeal as well as alar. Dangerous space, which is present between alar as well as prevertebral fascia. The perivertebral fascia is present between prevertebral fascia as well as vertebral fascia, as it is marked in different color. Yellow is an retropharyngeal fascia, orange is danger space, and blue is perivertebral fascia. As in below diagram, we can see the parapharyngeal space, which is an inverted shape, which upper by base of skull, lower till hyoid bone, laterally by buccopharyngeal fascia, laterally by medial pterygoid plate, masseter and parotid. The peritonsillar space. As peritonsillar space, when we take a cross section, we see the crypts, as it is covered by capsule, and there is another layer, that is buccopharyngeal, not a pharyngobasilar fascia. The space between the space between capsule and pharyngobasal, which is known as peritonsillar space. As anterior, mainly it contains loose fat and external palatine vein. As now we shall see the boundaries. Medially by capsules of tonsil, that is formed by pharyngobasilar fascia. Laterally by superior constrictor muscles, and anteriorly by anterior pillar, posteriorly by posterior pillar. As in this diagram we have taken cross section. not cross section, transverse section of the palatine tonsil. As this layer is capsule, this is superior constrictor. In between layer, this area is peritonsillar space. The peritonsil space has mainly a vein that is known as external palatine vein. As next, the submandibular space, as its boundaries are upper by floor of mouth, lower by deep cervical fascia that is present between mandible and hyoid, anterior inferior by anterior belly of digastric, posterior by posterior belly of digastric. As now we shall learn the parts, means there are three different parts: nasopharynx, oropharynx, hypopharynx. As first we shall deal about nasopharynx. I have brought an endoscopic picture of the nasopharynx. As it is an posterior pharyngeal wall, we can see adenoid over this. Adenoid is an lymphoid tissue that is present at the junction of the posterior wall and base of skull. As on lateral wall, we can see the structure that is torbus tubalis, eustachian tube. Torbus tubalis is nothing but an elevation over the eustachian tube that is known as torbus tubalis. The fossa behind the torus tubaris is fossa of Rosenmuller, as well as we can see posterior septum. The structure that are seen over the nasopharynx or contents are adenoid tissue over the posterior wall. On laterally we can see eustachian tube opening. Torus tubaris nothing but the elevation over the eustachian tube, and behind this we can see a fossa, that is fossa of Rosenmuller. As this is adenoid tissue, as it is an torbus tubalis, here it is opening, that is eustachian tube. As these are the structure that we are seeing on the nasopharynx. Next, oropharynx. Oropharynx is nothing but behind the oral cavity. As the structures that we can see is ola. This is anterior pillar, posterior. This is posterior pillar, this is anterior pillar. As in between this we can see the palatine tonsil. As here we can see the pharyngeal nodules that I have mentioned in the subepithelial layer. Let us see once again what are the structures see on the oropharynx. First, that is uvula. From this one layer comes, that is anterior pillar. This is posterior pillar. In between, palatine tonsils. On posterior wall there is nodules of subepithelial line. This much is enough for us. Next we shall go for hypopharynx, the structure that is behind the larynx is known as hypopharynx area. In height we have three parts: postcricoid, pyriform fossa, as well as posterior wall or posterior pharynx. As we are seeing following structures, it is a dissected structure. As we are seeing epiglottis. From this we can see cricoid cartilage, inferior horn of thyroid cartilage, posterior cricoid arytenoid. As in this much is not sufficient, so I have taken the endoscopic picture. As we can see, it is an epiglottis layer. It is an arachnoepiglottic fold. This is an arytenoid cartilage. This is the area of postcricoid. This is piriform fossa, and this is posterior pharyngeal wall. These are the structures over the hypopharynx. Thank you.